And today we're talking about a serious health topic, HIV and AIDS. And it turns out Oklahoma is still seeing an increase in new infections each and every year. But thanks to a big grant, many local health organizations are getting a little extra help that they really need right now. And here with us from the Oklahoma AIDS Care Fund to talk about the grant and just the broader conversation at hand, we have Cher Golding and Frederick Redwine. Thank you so much for being with us here today.
Thank you.
We appreciate it. And I do want to get started with this grant and then break it into two segments and then talk about the stigma, if you don't mind. So $186,000 going to 14 different groups. Kind of outline who these groups are and what they do here.
So with the 14 different organizations, they all provide direct services, either on the prevention, testing side of HIV, or actually helping clients, linking them to care, or providing emergency assistance such as housing, transportation, food, those type of things for those that are living with the disease. So it's broken out into those categories. These are dollars that are raised from our annual event, Red Tie Night.
Okay.
And we have a grants committee, and we take applications each year and look through those and see how we can best use our donor dollars to really support those in need. So we have organizations like Heartline 211 that takes the 211 calls for folks that might be in a crisis once they've learned that they're HIV positive or need to know where free testing sites are. Other options is a food pantry that provides food services. We have RAIN Oklahoma that provides case management and linkage to care.
Wow. Okay.
So there's a lot of great services and a lot of folks that are doing good work in our community.
It sounds like a really beneficial laundry list of whatever you need, you can go find help somewhere. And Frederick, $186,000, that sounds like a big deal for these groups.
It is. So for a lot of them, we are the sole source of their funding. The great thing about Red Tie Night is that money stays in Oklahoma. And specifically, Oklahoma City people and the Metro should be so proud of what they do because they're so generous, and that money benefits their neighbors, their friends, the families of those affected by the disease. And it just, we should be proud of what we do. We always want to do more, and we're working on it, but we are servicing 54 out of 77 counties in Oklahoma. So more than 75%, Oklahoma AIDS Care Fund, those dollars that we raise from Red Tie go directly to Oklahomans.
Yeah, just widespread health. Is there a plan to expand to all counties?
Absolutely. The rural counties are really difficult to link folks to care and to get them to actually understand prevention and treatment and to get testing. So we work a lot with Hope Community Center up in Tulsa, and they have a rural program where they go out and do free testing in rural sites. The stigma is probably the most difficult. When you offer a free testing in a rural community, a lot of times the health center will advertise that. It's right across the street from like the local McDonald's where everyone in town knows your family, and they're sitting there watching you go. Absolutely. So trying to come up with ways that we can bring services to them in a confidential way.
Okay, and you took me exactly where I wanted to go in access to those healthcare needs. From what I understand myself, it seems like that has improved a lot over the years, but there are still some barriers that people face. What are some other examples of barriers that patients might deal with when trying to find the best care? I
think cost definitely is. It's expensive if you can't get a free HIV test, so that's one of the gaps that we provide with the state health departments. If you're going to a city county health department or Variety Care or some of those clinics, there's a fee attached to that, and sometimes up to $100 to get a free to get an HIV test. So for us to offer that for free really saves lives, and the more you know your status, the less you're able to spread that to other people. So it's very important to do that. But cost, transportation issues, getting to and from the doctor. Sometimes our clients have to choose between keeping their utilities on versus taking their medication. So it does affect a lot of folks that are in poverty, and so trying to find ways that we can ease that burden for them.
Yeah, the costs definitely add up. What do you find that people who have been diagnosed with HIV or AIDS, what do they need the most? Is it physical care? Is it mental health care? What do you find?
I think it's both.
They need the most.
I do too.
An equal amount of both.
The disease has changed. I would, just like the Oklahoma AIDS Care Fund, we're sort of in our second generation of leadership and what we do for the state. The services have broadened. And just like the disease has changed, it affects more people. It affects spouses, it affects children, grandparents, jobs, all of those things that everybody does or needs to do every day to keep their lives going. So what's left is, yes, access to mental health care and also the services being provided by medical professionals. And one of the things that we do at one of our free testing sites, we can also, if someone tests positive, generally within the same day that they find out they've tested positive for the disease, they can also get access to direct services, a caseworker. Someone can tell them where they can start receiving their
Take them
health
to
care.
next steps.
Because it's so hard. We all know this going to the doctor. You go in one time, you find out you need to go back. Well, it's a month later, it's 2 weeks later, you have to take off work or you have to take your kids someplace. We try to
And
do
you
as
want
much.
answers now.
Absolutely.
Right. Yes.
Absolutely.
And I'm going to talk about just kind of how you have that conversation with friends and family and loved ones and the stigma around it coming up next. My last question to you before we get a check of the weather. Why are you two so passionate about this cause?
This is something that's very personal to me. I have a family member who's living with this disease, and so it's very personal to me. And to be able to give money back out into the community and really help those organizations that are making an impact really means a lot to me.
I'd say for me, I like the fact that our money stays and helps Oklahomans. I'm an Oklahoman. I live here, and I really want to. I'm happy to be here, and I want to see that the money helps the people that I see every day.
Yeah, and the people that you care about the most.
Yes.
Well, I know this grant is going to just help, worlds of people here. So really excited to talk about that too. Stick around for one more segment. We also have some viewer questions on that.